Good morning. Thank you everybody for staying till Sunday. We really appreciate it. We always see a little bit of a dip in attendance on Sunday compared to Saturday and Friday evening. So I think it's really cool that we put some great sessions on Sunday for you to really make your trip impactful and your attendance impactful here at the ALK Summit, whether it's virtual or in person. Just a couple items. At 10 o'clock, we have the 5-year survivor pick up on stage. So 10 o'clock, the first break. Don't go to the bathroom, just come right up here, get it done, right? And they'll let you on your way. If you need to bring your luggage because of checkout, if you need to bring your luggage down anywhere, you can bring it down into the room. It's happened at all the summits already, so it's not a big issue. And we have the whole back of the room. So if you want to strategically place your luggage in the back of the room, please feel free to do so. We'll have some fundraising updates for you guys this morning as the sessions go on. But we really appreciate everything that everybody's been doing for the summit. Your kind words. I think walking around the boat last night, seeing everybody have a good time was a testament of why we're all together. And I thought it was a great celebration for the summit. So thank you. So I'm gonna take a seat, and just so you guys know, if you guys need tissues, we're not gonna show that video again, I promise, but it'll be right here. So for our first panel, it's building your care team. And when we were putting the agenda together, I'm like, I've got to bring my care team in because I'm so blessed with such a great journey, especially early on. As we hear the different stories that people tell of their journeys, there's some difficulty. And I've been very blessed to just have a great care team. And I didn't really pick them. I just kind of got assigned to them in one way or another, but it's been the best possible opportunity for me. So we're just going to highlight some things and hopefully give you guys some tools to be a better patient, possibly be a better care team, helping your, caregiver, or what's the proper term now? Care partner, thank you. From a care partner perspective, how do you help support the patient? So without further ado, we have Lora Rhodes and Jennifer Johnson. Can you both just introduce yourselves and tell us what your role is at Jefferson? And I think that'll kind of set the stage a little bit for our discussion.
Sure. Hi, everyone. Thanks for having me this morning. My name's Lora Rhodes. I am one of the oncology social workers at the Sidney Kimmel Cancer Center at Jefferson. I'm a licensed clinical social worker. I've been a social worker for about 30 years. The majority of my profession has actually been at Jefferson. And I'm so happy to be a part of your team.
Thank you.
So, my name is Jen Johnson. I'm an MD, PhD, and I'm a medical oncologist. So not only do I treat aerodigestive cancers, I'm also the medical leader of our precision medicine team. So that means that I am here to find precision medicine solutions and individualized care for my patients, including Dan, who likes to have me do public speaking, where I'm gonna pass out.
It's a padded chair, so just fall one way or the other, you're fine. So we're just gonna jump in, and Lora, this first question's for you. So please, not everybody has the opportunity to work with a social worker. So can you tell me a little bit about the role of an oncology social worker during a lung cancer treatment and survivorship, how you're kind of brought into that conversation as well?
Sure, happy to. Okay. So I feel like the role of an oncology social worker kind of falls into two different buckets. And one is more concrete. So connecting people with resources, whether that's things in the community, financial resources, home care, insurance resources. In Philadelphia, interestingly or not, one of the biggest barriers to treatment is transportation. So it's just making sure people have access to their doctors and their treatment. And then, so one piece of it is this more concrete stuff. And then the other piece of it is more emotional support. And that can look really different depending on what someone might need. So most of the social workers on the team that I work on are have their clinical license. So we do individual counseling with patients and their care partners. So for some folks, it's very formal, like meeting with someone every week or every other week for kind of formal counseling. For other folks, it might be one or two conversations about how they're coping and maybe some suggestions about communicating with the people around them. It might be connecting them with a community of folks like yourselves for a support group, either in person or online. So, you know, it's both pieces, kind of the social support and then the emotional support. And it really varies how somebody might get connected with a social worker. Most large cancer centers, I would say all large cancer centers have a social work team. Not all of them are as robust as the one at Jefferson. So where I work, we each work with a particular care team, which is really nice because I think then you get, I think I have a more in-depth knowledge of kind of what the treatments are for lung cancer and what's available to folks who have that diagnosis. In other places, it might be one or two social workers who are caring for everyone with all different types of diagnoses. But I guess I would say if you have a question about whether or not you have a social worker available to you, ask your care team. If you don't, there are support services in the community. There's also these national programs like this organization, but also organizations like Cancer Care or the Cancer Support Community. So if you don't have a social worker at your cancer center, there are these national organizations that employ social workers that work with people on a more remote basis.
So how do you deal with someone like myself, right? So I only see Jen.
That is a loaded question.
Let me finish. Really bad pause there. So, you know, I see Jen, we're together roughly every 6 to 8 weeks. But it could be in person, could be virtual, depending on when a scan is, so on. Mm-hmm. So, you know, with how busy she is, I try to be respectful. But at times, I feel like you can direct me in the right direction mm-hmm. when I have a question. And it might not be related to like a symptom or something, but how do you balance bringing different portions of the care team in, whether it's appointment related, whether it's, you know, bringing in a mental health specialist into the care team? How do you, you know, get that information from a patient and ensure that they know that it's okay to come to you with those questions?
So I think very simply one thing that I tell people at the end of the initial conversation when I'm meeting them is, if you have a question and you're not sure who to ask me. Because if I don't have the answer, I can usually figure out who it is you need to talk to. And I think, Dan, you're right. I am probably more accessible than some of the physicians. You know, if you pick up the phone and call my number, you're going to talk directly to me. And then I can figure out, is this something that I can help with? Or do I need to call Jen and say, hey, Jen, Dan has this question. Can you give him a call back?
Yeah, perfect. Thank you. And I think that's a great segue to then talking to Jen a little bit about incorporating other specialists into a care team. Because as new patients, we don't necessarily know when it's the right time to see you know, let's just say a cardiologist, right? And we don't necessarily know what palliative care is, but it's a lesson. So can you tell us a little bit about palliative care briefly? And Lauren McGrath was here yesterday from Jefferson and had some great sessions, but can you touch on that and then other specialists and how you bring them in, you know, when to bring them in? Because I don't know when to bring people. I don't know when to raise my hand, right?
But that's just it. Part of being a medical oncologist is being a jack of all trades and trying to bring very individualized care to the table. Because what one person needs will absolutely not work for the next person who's in your door. And that is totally the wrong thing and the wrong approach for the next person, but it might work for 3 people down. That is what happens every day. So as a medical oncologist, I might be prescriber of chemotherapy, giver of medications, but I also get to run quarterback on the team. And so part of what I do is interpreting the medical situation in front of me, saying, I'm concerned about this potential toxicity. I'd like you to meet a colleague of mine in pulmonology, in cardiology, in gastroenterology. And part of what I do is trying to interpret the psychiatric portions of all this. And I do mean that in like the broadest of senses. Sometimes I don't know exactly what it is that's going on, but I can sense distress and I know that they need to talk to someone. And my job, therefore, is to connect my patient with someone who can sit and talk with them and help them to give voice to whatever is distressing them. Sometimes that's with Lora. Most times that's with Lora. It's always with Lora. Sometimes it's with psycho-oncology. We have psychiatrists who work within our oncology program. And sometimes that's with palliative care. Now, palliative care is a specialty unto itself. You can get into palliative care by either training as a family physician or an internist, but your goal is supportive care. In fact, we have rebranded, we are supportive care medicine and palliative care, because that's really a better title. They are there for all kinds of symptom support. Simplistically, sometimes that could be pain. There is pain associated with cancer. We do not want it to be there. And they can help to find the right medical strategies to help combat that. We also don't want there to be nausea, peripheral neuropathy. We don't want there to be depression, anxiety, fatigue, all of these different things that come up. And palliative care is there to be the focus of how do I make that better? Dividing and conquering can really make each member of the care team stronger. While I am sitting there going, okay, what is this molecular profile? What does that scan look like? What medication do I need to respond to this? How am I going to manage this dose? I can also turn to my colleagues and say, okay, well, I'm doing all that. Can you free me up to focus entirely on that aspect by focusing deeply on all of these supportive care mechanisms?
So client or patient says, hey, you know, I have this going on. And then there's the misconception with palliative care. Do you, or mental health, the stigma, right? Where they raise their hand, they're like, I don't know how to deal with this. And you're like, well, you need assistance, right? And we have those tools. We can put you in touch with those people. Do you guys find a lot of resistance from the patients or their care partners to where they don't want to see some of these specialists because there's a stigma, because they're afraid of, you know, continuing their care team? It's more appointments, it's more difficult. How do you guys navigate ensuring that the people get proper care? You give them that advice, but them actually taking that action to, you know, set up the appointment, show up, so on.
So, you know, I think it's two different things there. So one is the stigma around asking for help, and which is real, especially around asking for help around mental health, right? Because I think a lot of us sort of, grew up in this time of, like stiff upper lip and, we want to be strong, and kind of that means never saying that we're having a hard time. I think one of the things that we try to do is just, we ask about it. It's how your mood is just as important as how you're feeling physically. So we ask about it in an effort to normalize it, to let people know that it's okay to say I'm struggling, and then also even more important to say, okay, so we have some things that we can do to help. So that's one piece of it. The other part, though, that's very real is that it is one more appointment, and that's hard to navigate. Just in a very simplistic way, one of the things that we try to do is match up appointments. So with our supportive care team, we'll say, hey, this person's coming in to see Jen on this day. Is there a way we can do back-to-back appointments? Just to, it's no fun coming into the city, and it costs money and it's time. So if we can make that a little bit easier, we do. The other thing that, one good thing that came out of the pandemic is just this increase in telehealth visits. So we do a ton of telehealth visits. And sometimes that's just easier for people if they can do an appointment from home with our supportive care team. It just makes things a lot easier.
Yeah, and I felt like we had formal appointments previously, but now you'll just have a casual drop in, it feels like. And I mean, that's probably just how I interpret it, given our relationship now over 4.5 years. So, I mean, I think that's a special skill that both of you have, where you create comfort in the patient and in their care partners to ensure, hey, it's okay, right? We're here to help. So I think you guys really create a great balance for that. So good job.
Just one more thing I wanted to add there is that I think that's really the benefit of working on a team, that we have a team approach, so that I can take a look at Jen's schedule for a day and say, oh, here's who's going to be here. I'm just going to stop in and say hello.
So it's formal, but informal in your approach, right? Yeah, that's truly special.
I have to say that part of that is also on my side, giving name to some of what I'm seeing in front of me and recommending that they speak to someone. And what I mean by that, if I see somebody in front of me where I'm casually asking questions like, how much are you sleeping these days? Oh, were you able to get out?
Not much last night.
Separate problem. How much are you sleeping? Are you getting out and golfing? Because you told me you really like doing that. I might be subtly doing an entire depression questionnaire with that patient and then saying, from all of those questions, I believe that you have depression. You have to say it. You have to hear it. And then I will tell patients, just the same as we would talk about your nausea and a way to deal with your nausea, I need to talk to you about your depression and how we are going to deal with your depression. I might not be the person to help you with that. I'd like you to talk to, and then depending upon the level, I'd like you to talk to Laura. I'd like you to talk to Brooke. And also reminding people that if you suffer, it doesn't work better. I don't know why I have to say that. You're laughing, you know what I mean. I have explained, and I would like a t-shirt that says you don't get a gold star if it hurts. Like, I don't want you to suffer through all of this. It does not make my drugs do different things in you if you are hurting. In fact, if you are hurting emotionally or physically, that pain is stealing some of the energy that I want. I am very I don't know what the right word is here. None of them were nice that just passed through my head. I'm stingy. Go with that one. I want the energy. I want that energy to help fight this cancer, and I don't need it going to all these other things. So they need to be taken off your plate.
Good, thank you. I want to pivot to care partners for a brief moment, because a lot of what we're talking about is patient related, right? But sometimes a patient's symptoms are conveyed through communication with a care partner. We have some absolute rock star care partners here and attending virtually so that they're better equipped to help the patient in their diagnosis. So what resources and how do you guys really like harbor that relationship to ensure that they're taken care of too? Insurance companies only paying the bill for the patient. Nobody's paying the bill for the care partner. So how does that all work? And how do you guys incorporate the care partner into the conversation regularly?
I think that it's recognizing the importance of having a partner in this and having a partner that feels and knows that they're seen and understood and the value that they bring to our team. And it's asking how they're doing, very simply just saying to the spouse or the child or the sister or the friend who's in the room, how are you doing? And also recognizing that they know you better than we know you. So with the patient's permission, I will often say, if there's someone else in the room, is it okay if I ask them how they think you're doing? Because sometimes it's a little bit different story.
I'm sure it's funny when, I say something and Britt's like, you're lying, and kicks me in the ass and you guys just chuckle, right? I'm sure. But that's being a good care partner too, keeping the patient honest.
Because now I've been infected by that. So I will literally look at people's care partners that I've known for a while and be like, is he lying to me? I was like,
you already do that.
It's
so funny. Sorry. I really struggle with not taking supplements, not taking vitamins, because I just have this fear in the back of my head that, oh my gosh, what if this supplement or this vitamin or, this pill to give me big muscles is going to counteract with my medicine? And how do you guys give that guidance to ensure someone feels that they have that sense of balance and they are putting the right things in their body? What's safe, what's not safe?
I love the integrative medicine approach and complementary medicine techniques, and definitely encourage people to talk to me about what those supplements are, because they're not for everybody. It is not something that you need to now go run out and check the internet for. But for some folks, they have always been like interested in some variation of complementary medicine, whether it's vitamins, whether it's alternative medications, like other things. And when you come to a medical oncology clinic, it does not mean, well, all of that stops now, my meds or no meds. Like, it does not have to be one way of treating cancer and treating symptoms associated with cancer. It just needs to be a dialogue. So if you're interested in taking something, bring the bottle. Please bring the bottle. I do not know the brand names of everything. I am trying. Like, some of them I know. Like, I know straight out. Like, I have researched them. I have looked at them. I will be able to tell you about them. If I don't know it, I'm going to take a picture. I'm going to look at it. I'm going to look it up. I'm going to make sure that its metabolism does not interfere with your medications and that we don't change serum or blood concentrations of any of the drugs. And then we're going to figure out if it can pair together. Just like multiple different forms of care, like, you can have different aspects from alternative medicines as well.
Great. I think this has been a hot topic all weekend, so I don't want to beat a dead horse, but I want to give you 30 seconds, your feelings, second opinions, and when those second opinions differ from anything that you believe in.
So second opinions are great. I don't pretend like I know everything about radiation oncology, surgical oncology. I have no problem reaching out to other disciplines at my own hospital. Why wouldn't I want to talk to one of my partners somewhere else? These are my people. We're weird, but I like it.
So if someone within their care team, and let's say you're their second opinion, you know, it upsets the doctor, the medical oncologist, what's your advice to that person? Part of me says, like, beat it, get out of there, kind of like you told me very early on, and all the oncologists that I've seen very early on in my diagnosis was, if they've got an ego, you got to go, because it's not going to help you. So how do you balance that?
I think part of it is just to understand the why. Like, why you ascribe it to ego. Are we sure it wasn't something else? Like, why would you be upset about that? Like, what was it about that interaction? Maybe it was literally something personal. Maybe it's because they didn't pick up the phone and call you. That's weird. If you're somebody's second opinion, you pick up the phone, you call the primary medical oncologist and you're like, hey, hon, I just saw our patient. I was thinking this, what were you thinking? And you talk it out. Maybe they didn't do that and I'm a little offended. Like, why, you know, but you've got to understand what the mechanism is in there. And you should feel free to ask your doctor why they are having that emotional response.
So there's a balance in seeing the right amount of patients. Seeing too many patients isn't good, because you need time to set everything up. You need time to continue to build your care team. You need time to do your research. How do you guys find the right balance in the amount of patients to see to ensure that you're giving the proper care to each person you do see?
I'll let you know. No, work-life balance and within work balance is a constant struggle. And if y'all ever find anyone has got that sorted, jennifer.m.johnson@jefferson.edu. We are always struggling to balance what we need, but clinical care comes first. I might have a research paper that I want to write. That thing is just going to sit there if I have a patient that needs me. But how we deal with that and how I try to help more people every day is by remembering I'm not doing it by myself. I get by with a little help from my friends. Like, I ask Lora to help. I had Squirt to help. I ask radiation oncology to help. I have a nurse practitioner who is the bomb. I work with all these people, and by making sure that we delegate authority and share care, we help more.
Perfect. Oh, this is dangerous.
I promise this is unplanned, but you were talking about work-life balance and just how you manage that. And one thing I will say, despite the number of hours that they both put in, they care about our family so much. And because they care about our family and put so much time into us, that's what makes Dan's care team just so wonderful. They take so much time out of their personal time coming back from vacations or driving over an hour to come to our golf outing and our dinner, and they just support everything that we do no matter what. So even though their work-life balance might not be great, they are putting so much love and effort into us as patients and care partners that it is worth it. So I wanted to say thank you.
Should I get the tissues? Yeah, no. Okay, I got it. You're good.
I think that's an important thing or piece of advice for everyone here too, just to make sure that if your care team hasn't asked, make sure that they know about your life outside of the hospital or the clinic, because that's really important. One of the other pieces of advice I give too for folks who are outpatient and are going to be inpatient is I always say, bring a picture of your family, of your life outside the hospital for when you're in the hospital. Because I spent the first couple of years of my career on the inpatient side. I think that kind of being in the hospital sort of strips you a lot of your identity. You know, you're not wearing your own clothes. You're not in your own setting. You're around a lot of people who are strangers. And I think just having that picture of, this is my life outside of this room is really important.
Great. I'm going to jump, and I have one more question for each of you. I forgot your questions. I got to ask them. I'm just kidding. So Laura, I'm going to jump to financial struggles. So if someone's struggling financially, how do they know what is available to them for tools? How do you help? What is available nationally versus locally? Can you just touch on that for just a couple minutes?
So I think that's another area where it's important to ask for help if you need it. And one of the things that I always say is it doesn't matter if you have the very best insurance, having cancer is expensive, right? Like oftentimes there is less money coming in and more money going out, and the math doesn't add up. So it's important if you're struggling to ask for help. And it varies. So in terms of cost of medications and copay assistance, that is widely available for kind of the more expensive targeted therapies. The copay assistance programs have much, much higher income limits than a lot of other programs. So if you find out the copay for your medication is going to be $1,000 a month, $2,000 a month, $10,000 a month, say something, because oftentimes there is help available. I would go back to ask to talk with a social worker, because a lot of the assistance that's available is available locally. There are a lot in our area of community cancer organizations that provide support to patients. There are foundations set up by grateful patients and families. Like you and Brittany provide tremendous support to our patients for things that insurance doesn't cover. But you don't know that that's available unless you ask.
Great, thank you. That's tremendous. Jen, last questions for you. And I think it's something that we have talked about now for months, thinking about this, and we wanted to ensure that, it was conveyed, but give me two things each, and I'm a little bit off what we actually wrote out, but it's near and dear to you. So give me two things, and it could be collectively or individually within a care partner or a patient, to be a model patient, be a model care partner, just being good. Like, what does that balance look like? Give us a couple things that, high level, that they can take away possibly that they may not already be doing.
First one is there is no such thing as a model patient. There is you. There is you and what you need. Come to me and tell me what you need. That's it. It's that simple. It's come without some expectation of what I think you're going to act like. Come and tell me in that room or on that screen what you are going through and what you need. Even if you don't think that I'm necessarily going to be the one that's going to be able to provide it, I now know what is going on inside you better than what a scan or a lab test is going to show. And I'm going to find you help. You ask any medical student why during their interview season, why do you want to be a doctor? And every single one of them say, I want to help people. We never lose that. So let us.
Perfect. Well, I just want to take a brief moment and thank both of you for carving out a Sunday morning and joining us. And, obviously driving in it's the same drive pretty much that you guys do every day. However, it's on a Sunday, and coming back from vacations and stuff, we appreciate you spending time with us. So thank you.
Thank you for having us.